Hey y'all, Crystal here. It is Functional Nutrition Friday. My name is Crystal Meadows. I am a nutritional therapy consultant and an autoimmune warrior, and I am on a mission to serve the chronically ill. My life's mission is to help you, to teach you everything that I can about how you can recover from your autoimmune or other chronic illness, hormonal imbalances, so that you can get back to living your life to its fullest, that you can get back to that energy and vitality that you've known before, and so that you can fulfill your life's purpose. So that's why I'm here. That's what we're trying to do here. Here on Functional Nutrition Friday today, what we're going to be talking about is autoimmune disease and how the conventional and functional approaches differ. And I want to start by saying this is not an either or thing. This is not us versus them. This is not one is better than the other. We just need to understand how they're different and why it often takes us. We often need to have more than one practitioner on our healthcare team to help us get to feeling our best. I do. I have more than one. I have a conventional doctor and I have a functional neurologist on my healthcare team. And that's how I'm working my way back to remission. So, with the conventional approach, what you need to know is that what they're taught to do in medical school is they are taught it's more an approach of what. What disease does this patient have, and what medication can I use to suppress those symptoms or to treat that disease? And again, this is not good or bad. This is just what they're taught. That's what they're taught in medical school. And so you go to your doctor, you tell them, I'm tired all the time. I've gained weight and I don't know why. I'm exercising, I'm eating right, and the weight's not coming off. I'm feeling depressed. I really don't know why. And so your doctor runs some labs. They look at your lab work, and one of two things will happen. Either everything will be in the lab's range, within range, and the doctor will say, according to our standards, you don't have any dysfunction going on. And so you don't have this disease at this time. So maybe you just need to try harder to lose the weight. Maybe you're just getting older. That's kind of normal when you're getting older to not feel as good. These are things that you're going to hear that you may have heard from a conventional doctor. I know I've heard those things from conventional doctors. Or if you are actually, if your labs do actually fall out of range and it fits the pattern of some sort of disease that they can label, and they can say you have hypothyroidism or you have Hashimoto's thyroiditis, then they can say, okay, here's the disease that you have, and here's a prescription for the drug that's going to suppress those symptoms or that's going to replace that hormone that you need. And that's the conventional approach. And I will say that many of us with autoimmune disease do need some sort of prescription intervention. Okay, so prescription drugs are not always bad. That many of us actually do need some sort of prescription drug intervention, but many of us will actually feel our best when we put that in combination with some sort of dietary and lifestyle intervention, some sort of dietary and lifestyle change. And so with the functional approach, rather than just focusing on what disease and what prescription medication, we're thinking about why. Why is this person that I'm talking to having these symptoms at this time? And so this is a process of just unturning stones and continually asking the question, why? And I'm not a doctor, so I can't diagnose or treat, but I can look at lab work sometimes. And what I can do is I can look at the lab work with a different approach, with a different lens. And I can say, well, yeah, everything's in range, but this is actually not necessarily optimal. Right? There's a difference between being in range where you don't have a disease and actually being optimal and getting to where you're going to be feeling your best. And so there's a gap there that conventional medicine does not recognize at this time. Most conventional doctors do not recognize that gap at this time. And then also for me as a functional practitioner, I don't have to be chained to your lab work. And so if your labs tell me one story and your symptoms tell me another, I'm going to listen to your symptoms. I'm going to listen to the story that your body is telling me with your symptoms, the fatigue, the depression, the weight gain, and we're going to keep trying to uncover the root cause of why you're feeling that way and what changes we can make that can help restore whatever underlying imbalance is causing that. So in the case of autoimmune disease, there are multiple factors that go into this. It's not just one thing that every person has. It would be nice if it were just one thing that every person has, but it's not. Every person with an autoimmune disease there's always going to be a genetic component, and you can't change that. Yes, there are things you can do to support that kind of genetic mutation, but you can't change the fact that you have a genetic mutation. There's always also going to be at some point the presence of something called leaky gut. And this is where your gut is one of the barrier systems in your body. And so the way it's supposed to work is when you eat food and digest it, then your body's supposed to absorb the nutrients from that. And then it's supposed to excrete the toxins or any unusable material. And that's how a healthy gut is supposed to work. Well, there are a variety of things that can cause leaky gut, but when that barrier becomes permeable, then you can maybe kind of see where this is going. Those holes that can happen in that gut barrier. Then things can filter into the bloodstream that aren't supposed to be there, like undigested food particles, or the toxins that are supposed to be excreted can actually flow out into the bloodstream, which of course is not a good thing. And then sometimes this can even keep you from absorbing the nutrients, the good parts of the food that you are eating. So healing the gut is a really important step in the functional process, for sure, and we can do that with dietary and lifestyle interventions. And then there's also always going to be this other factor over here. This can get really, really complex when we start to look at environmental factors. So this can be mold exposure, if you live or work in a moldy building. There are certain infections that can kind of trigger autoimmune response, like Lyme disease, Epstein-Barr virus. It doesn't mean they always will. It just means that they can be a factor in these, in causing these imbalances that lead to this immune dysfunction. Those are pretty common. And then there are also other triggering events that can play a role here. Stress is a really, really, really big one. And this can be just ongoing life stress of trying to live a fast-paced lifestyle. It can also be an event like a divorce or some sort of ongoing financial strain. It can also be the death of a loved one. There are many, many stressful events. That stress is going to impact our immune system. It's going to impact our gut. It's going to impact all of these systems in our body and can lead to an immune response. And in my case, the trigger for me was a car accident. It wasn't the stress of the car accident. It was actually that I sustained a concussion in the car accident that was mild enough that it went undiagnosed. And so concussion causes leaky gut, and off we went. So I do want to give you a takeaway today, something that an actionable step that you can take going forward into this next week. If you do have a diagnosed autoimmune condition, the first thing I always recommend to people is that you need to do the autoimmune protocol, the AIP, for at least 6 weeks. And that's going to help with that, with the gut healing. That's always the first place to start in my mind. And there's more to it than just eliminating the right foods, which we're going to talk about more. And sometimes this is where you may need to have a qualified practitioner to help you through that. But there are also lots of support groups. I'm also here to answer any questions you have about that. But if you're wanting an actionable step that you can take today, that's my best recommendation, is either start with something like paleo or the paleo autoimmune protocol, and see how much better you can feel with just 6 weeks of strict paleo or AIP. All right, y'all. That's going to wrap it up for today. Let me know if you have any questions and have a great weekend.